Hi, Chris Westfall here of MedicareAgentTraining.com and SeniorSavingsNetwork.org for those seniors who are finding us on the YouTube channel these days. Real quick, important message for agents who are contemplating or are currently considering replacing someone's employer-based plan that they have right now through their employer that they may not be happy with, replacing that with a Medicare Supplement plan, returning to original Medicare, maybe even starting Part B of Medicare for the first time because they did not need it before on the employer plan. Some key things you need to look for include the following. See, I've heard of this mistake being done before, and just today got a support ticket from an agent at MedicareAgentTraining.com sending me a list of drugs that this person was taking and the results from Medicare.gov, and it clearly showed that the cheapest, the least expensive drug plan is $5,000 per year total out-of-pocket cost for this person. Come to find out, they're on an employer plan that they're paying premiums for, and they have a high deductible, limited network, and all the things going on with typical Obamacare right now, and they want to leave that for the freedom and flexibility to go on a Medicare plan with a Medicare Supplement plan or Medigap plan now, and go to any doctor they want to with no deductible, no copayment, and all that stuff. Yes, I get that, but one factor that you have to factor in as an agent for this person is what's going to be the impact of a Part D drug plan. Yes, I know many of my agents, like me, don't sell the Part D drug plans, but it's a major component of the total picture that we must take into account if we're going to do a good job for our clients. The last thing you want to do is put somebody on a $130 a month Medicare Supplement plan and then tell them, yes, go get your Part D drug plan, to have them come back and say, oh my God, I'm paying $4,000 a month for my drug plan, and yeah, I saved, money on the Medicare Supplement, but it's killing me on the drug plan. I wish I could get my employer plan back, but they can't. So if you're considering moving somebody from an employer-based plan that has the whole package of major medical, typically sold to those under 65 or enjoyed by those people, but they're in retirement and they're on that plan, you must consider what's the Part D drug plan cost on them. Now, most people are taking generic drugs. It's not going to be an issue, but as in this particular case with the agent today, just two drugs took it from very small to $5,000 a year, just like that. And all of a sudden, it's no longer a really good deal to go back to original Medicare and get a Medicare Supplement plan because they're on these very expensive Part D drug costs they're going to have to incur. So just please take that into account. If you get a call from somebody who says, I want to leave my employer plan, or I want to start Part B for the first time and leave my employer plan. Yes, it's an open enrollment case, guaranteed issue, very easy to do if it's starting Part B for the first time. Please take into account the drug plan. Even if you don't write the drug plan, look it up for them and give them some good guidance on this may be a good deal for you, may not. Let's take a look at your drugs and see how the total package is going to impact you. That's like having somebody who does property and casualty insurance want to move all their business to you because they get a good rate on a car insurance rate, right? Now you got their car insurance covered. Oh yeah, you brought all your business to me. Well, your homeowners is going up 3 times. That's the bigger part of the deal there. Similarly here, if somebody's going to get crushed with 10 times the cost on their drug plan than they were expecting or what they had last year, guess who they're going to come back on? You, for giving them wrong advice. Look at the drug plan. It's the critical component when helping seniors with their Medicare. My name's Chris Westfall over at MedicareAgentTraining.com, and yes, it's no Shavember. Have a great day. Bye-bye.